Hello, everyone. Welcome to our panel on women's well-being and COVID-19. Today, we're going to be talking about women's unique experience in the pandemic. And of course, as most of us will know, during this time, both from surveys, from the work of our researchers, and for our own experiences, that for many Canadians, they have been reporting increasing rates of anxiety and depression during the pandemic. And I think I saw one survey, as many as 1/3 were saying that their poor mental health was affecting their daily living. And there's a unique women's story to be told in the middle of all of that. And that's what we're going to focus on today. Which women are struggling? What's the lesson on resilience? What do we need to do in the mental health care system to focus on that? Because I think what's also really exciting is that we're having more and more of these conversations. And out of the pandemic, we've seen a real opportunity. We see the government focusing on mental health and investing like never before. Corporate Canada's interested and also making investments, talking about how to improve mental health in the workplace. We also know Canadians are even more focused on mental health. I think these changes are unprecedented themselves during this unprecedented time. And that is a real opportunity for us to also talk about solutions, which I hope we're going to focus on today. I want to introduce you to our fantastic panel. We have Joanna Peets, who's an associate professor of psychology at Carleton University. Dr. Peets' research focuses on financial decisions, time perception, and close relationships. Lara Aknin also is the chair of Lancet's COVID-19 Commission, COVID-19 Commission on Mental Health Task Force. Her research focuses on the consequences of human happiness and pro-social behavior. Marcia Campbell Yeoh is a professor in the School of Nursing at Dalhousie University. Her research focuses on interventions to improve outcomes of medically at-risk newborns, specifically related to pain, stress, and neurodevelopment, as well as their family's well-being. Carla Hilario is an assistant professor in the Faculty of Nursing at the University of Alberta, and her research focuses on health equity through inclusive health systems and services. So I want to start the question, kick it off with a question to Joanna. Joanna, even before COVID-19, we know that women experienced higher rates of mental illness, anxiety, and depression than men. Then the pandemic happened, this, time like we've not experienced before, certainly in our generation. What happened in terms of women's mental health?
Yeah, there's actually a lot of research has been done since COVID started on mental health and how it's affected all of us. And one thing that really stands out here is that so many of these studies have consistently shown that the increase in mental struggles has been a lot worse for women than for men. So just to highlight a couple of these studies that showed that, one study examining 2,500 American Canadians done by Jason Zhang at the University of British Columbia, they assessed people 1 week apart, starting in March all the way through to June, and they were looking at how much does depression increase or depression scores increase in this 1 week. So controlling for how depressed they felt at the beginning of the week. And they found, well, everybody's depression scores increased during this time period, but the increase for women was about 1/3 higher than the increase than for men. So they really seem to be suffering more, getting worse quicker than men. And another sample collected by Lisa Best at the University of New Brunswick, which was also in the early times of the pandemic, so April 2020. And they assessed like a range of indicators of psychological wellness, such as worry, panic, depression, emotional distress, just risk perception as well. And women consistently scored quite a bit higher than men on all those factors. So there is really a lot of evidence that disproportionately women suffered more, especially in the early times of the pandemic, than men in terms of mental health.
What, Lara, in your paper that you wrote with Joanna, of course, while we're talking a lot about these increasing mental health worry spots, a significant a number of people actually also started showing resilience. So what's happening there? How do we explain these higher rates and then this evidence of resilience? Can you explain that pattern?
Certainly. So I think there's a lot going on and it's hard to unpack here. And I think one interesting and amazing feature of the pandemic is just there has been so much evidence coming out so quickly that it's almost hard for our human brains to fathom and compute and collect. However, that being said, we did try to put together a review paper kind of understanding what have been the mental health consequences of living under COVID, particularly during the first year, really focusing on what are some of the large, most representative and kind of robust studies. And what we found, kind of consistent with what Joanna said, is that there was a stark increase in mental health concerns, particularly in the early months of the pandemic when we were focusing on evidence. This is primarily focused on adult samples and primarily from the Western world where most of the data had been accumulated at the time. So in early months of the pandemic, as Joanna mentioned, I'm speaking on averages here, but depression, anxiety, and psychological distress in many countries were showing threefold rates than we had seen before. But as time progressed, even by the summer of 2020, we were starting to see that many of these measures of psychological distress were returning to closer to baseline, and in some places were even below or at baseline. Not everywhere and not on every measure, but I think what this showed was a surprising profile of resilience, that people, many of us, including researchers, did not anticipate in advance. Now, on the one hand, this is really surprising and unique, but on the other hand, this kind of aligns with a lot of evidence that has emerged through social psychology over the years, showing that people don't always perfectly anticipate how they're going to respond to some of life's biggest challenges and thrills. For instance, we might think that if we lose a partner or lose a dream job, we might be devastated for the rest of our lives or the foreseeable future. But in fact, many people, not everyone, tend to respond in stride over time. Time does heal a lot of wounds, not all of them. But COVID was a real extreme test of this psychological immune system, if you will. It was really unique in terms of its scope, influencing the breadth of our lives. It had this unending time frame. Still does for many of us. And it was a constant shifting playing field where I think a lot of people were making a lot of things, adjusting their lives in so many ways. But for better, for worse, I think a lot of people found some surprising coping strategies. They're not perfect fixes. They're not perfect proxies for our life beforehand, but people have made do with Zoom birthday parties and drive-by birthday parties and other ways to connect. And so this isn't to minimize the challenges people have faced, but I think by and large, a surprising swath of the population has found many ways to kind of adapt and not remain in these depths of depression and anxiety that we saw in the early months of the pandemic.
I'll just put a follow-up to you, because I know when I interview stress researchers, I mean, one of the things they say is that really this is an extremely anxious and stressful time. Feeling anxiety and stress is actually a normal response. Do you feel that message has been like sort of lost in some of the media coverage? Have we over-exaggerated where we're doing poorly and missed out on this lesson of resilience? Because obviously a lot of women are part of that stat too. Some started off and then somehow managed, with all the new burdens of home and work life and kids being at home, they managed to make that work and even go back to kind of their previous mental state. So did we make a mistake of over-exaggerating that? Do we need to talk about resilience a bit more as a society?
So I agree with the sentiment in the statement that stress is a really adaptive response, particularly in the short term. It's our body's way of mobilizing to take on stress and external circumstances that need our attention and our effort. The problem is when this remains elevated for a particularly long time, this causes a lot of wear and tear on our body and is not good for our system. But I do think, what a lot of the data we reviewed, these large samples, these representative samples with really robust analytic plans showed that over time many people did find some strategies to adjust, and I to be honest, I haven't seen much coverage of that, and perhaps it could be beneficial. I mean, some striking statistics. I mean, I think many of us assumed that unfortunately, there would be a huge rise in suicide rates and other very concerning statistics. But early on, at least in the pandemic, when I was reading as many papers as I could on this topic, there was a surprising lack of evidence to support that point. A really stunning paper by Perkis and colleagues showed that in 21 countries, there was no rise in suicide rates up through October last year. And so while I think many of us anticipated the worst, I don't think the data has really borne that out. And I think there might be a lot of, I think there are at least two really comforting messages there. One is that there is this story for human resilience, but I think another really important lesson that can sometimes get lost in that is the groups and the individuals that are really struggling do deserve our special care and attention. And I think that's where we should be directing our efforts. Not that there hasn't been a challenge for everyone, don't get me wrong, but there are some groups of the population that have struggled immensely. And I think that's where we can focus our time and attention and our extra care to really help manage these next few months and years.
Well, I mean, that's an excellent point. And I guess one of the questions is going to be that while we're surveying people in the moment, what is the long-term fallout of that chronic stress, of those mental health issues for people who are in particularly vulnerable situations for all kinds of reasons? Carla, I'll put that question to you. What within that big story of those general women's statistics, what are the groups? Who are the women that we need to be particularly concerned about right now?
Thanks, Erin, and thanks, Laura, for contextualizing what we've seen so far in terms of the pandemic. One of the groups that we know struggled even before the pandemic, and where we have seen a rise in prevalence of mental illness, depression, anxiety, for example, is youth. So we do know that youth are particularly affected, and globally, higher mental health needs have been reported among youth, and this is in terms of depression, anxiety symptoms. We also know that, as we've heard from other panelists today, that COVID-19 also affected newcomer communities, racialized communities, including communities where there are a significant proportion of frontline workers. So COVID itself affecting workers and their communities, but also grief and trauma surrounding illness and death of loved ones. I do a lot of work around mental health, psychological well-being, and social determinants. And we know the key social determinants of mental health, for example, are access to care, poverty, unemployment, and racism. So in terms of access to care, we saw significant transformations in health systems and care delivery. This led to reduced in-person care. We saw shifts to virtual or online care, and those weren't accessible to some groups. We also heard from other panelists from today's event already about the hardships, unemployment, and poverty some women and their families experienced due to the lockdown and stay-at-home, stay-in policies. And then third, I mentioned that the pandemic has highlighted particular inequities and systemic discrimination faced by racialized groups in Canada, and those associations between discrimination and particularly mental health outcomes are well established in research. And so when we see a rise, and there was a dramatic increase during COVID-19 of reported discrimination and hate-related incidents, we know that that's also going to shape mental health for this group.
I mean, in fact, the role of experiencing racism and mental health is a really developing area in the research, and so fascinating and important to look at, because I think sometimes our system is blind to those factors, even in talking to people when they come in dealing with mental health, asking them about their experiences and their past traumas. So I mean, that's a really important point you raise. I guess the other thing that strikes me is that sometimes we talked about working from home as, not that it was hard, that the challenge was that your kids were there, but also a lot of people didn't have homes that were, where they could all work at home, or they had a lot of family members living there. Carla, let me just follow up and ask you that again, because you raised this point, like virtual care was kind of seen as being a really good solution. I remember writing about even before the pandemic, we were just waiting for psychologists and psychiatrists to move towards virtual care. But the pandemic also exposed some real equity issues around virtual care. Can you speak a bit to those?
Sure, Erin. So we spoke with youth about peer support, a couple of different projects around mental health and COVID and peer support. And one of the things we heard was how virtual care, like you said, is, you know, it can be very helpful for some because it actually reduced barriers in terms of not having to go to another to an unfamiliar setting. You can there might be some added safety because you're behind a screen. But for some who don't have a private space in the home, they were hesitant to seek care while while being in earshot of family members, and then also there's also the subpopulation that might not have access to stable internet, or let alone internet, or have it seems like we all needed to be Zoom literate quite quickly. I was actually on parental leave when the pandemic happened, so I was very late to the Zoom game. But it seemed like that there were some expectations around just being around digital literacy that people had to adopt very quickly, and not all groups were able to.
I want to put that question also to the larger group, because I think this idea of equity is so important when we do a panel like this on women's well-being. I think we have to be really careful not to treat women as a homogenous group. We know that it's very individual experiences for women and different groups of women. Do any of you want to weigh in on other inequities that you think have kind of been highlighted by the pandemic that we need to address?
I'd like to just note that in one major factor in our review that kept coming up is not just that women struggled, but a new profile of risk was also younger individuals, which aligns really nicely with what Carla was saying just a minute ago, but also parents of children under the age of 5. And as someone who had 2 kids at home under the age of 5 during the first year of the pandemic, I remember being just so desperate for daycare to open. And I feel like, we can circle back to this later, but there have been some amazing papers looking at how women have, and Joanna can speak to this too, women have borne by and large, a way heavier load when it has come to both childcare and household chores and concerns. And chores in particular have been a huge detriment to well-being, and it has fallen almost disproportionately so on women. And so I feel like a lot of these factors, having young children at home, having children at home was a challenge, but having young children at home in particular, I think it was one of the clear dimensions in which there were gross inequities in how much time people had available, and the ease with which they were able to connect and juggle the balances of everyday life.
Well, let me just pick up on that point then and ask you, Joanna, because I can remember, maybe it was a couple of years ago before the pandemic, writing a story, a hopeful piece on how the load of chores in the household that gap was narrowing. Did the pandemic widen that gap again for a lot of families, for putting the burden mostly on women?
Well, from what the data was showing in terms of what people reported, how many hours they spend on chores and on childcare, the gap didn't change. It was just everybody was doing more. And if men were spending, say, 20 hours a week on childcare, they were now spending 40, and if women were doing 40 initially, they were doing 80 now. So the gap was similar, but since both of them increased, like the burden was still more on the women. Another thing that Lara already said is what isn't so often mentioned along with childcare is that chores surprisingly also increased because people spend more time at home. I remember this really hopeful story that said, 37% more home cooked meals during the pandemic. We're all living healthier. I'm like, but somebody has to cook all those meals, right? And then that's adding to the chore list. So there is a lot of additional time demands that came with staying home so much that people don't often think about, but they have to fit in people's lives somewhere, right? And something has to give. But surprisingly, people have managed to do that, right? And I think like it's, for me personally, it has shown me that sometimes you can cut corners and the world doesn't end, you know? So there is also some resilience message in there as well, but it's just the entire wave of time demands that crashed down on people during this, during the lockdowns, I think was unexpectedly high.
Well, I know that I do you remember all those videos at the beginning of people baking bread and making these great baking, and I mean that never happened for me in my house. So I always felt that I kind of failed on the pandemic side because I didn't really step up there. And I remember too that when I did that piece, how everyone's least favorite chore was laundry, and almost like women were often left doing the laundry. Like it wasn't even like cleaning out the toilet, which if you think about it is like a quick thing. It was like the burden of laundry. So I can see you add that all in, and then like you say, Lara, your kids are home with you, your little kids, you're like managing work at the same time. So it's not that the gap widened, but that women were suddenly doing so much. Now, Marcia, I want to put the question to you because you research a particular group of women who also had sort of a new burden during the pandemic, and that is having a baby in the middle of a pandemic with all the restrictions and the physical distancing and the different rules in the hospitals. Can you speak a bit to what their experiences were in the research that you did? What kind of stories were you hearing from them?
Sure. Well, thanks, Erin. You know, we have done research both in moms of healthy newborns, but we're particularly interested in some of the unintended consequences of the policies that were put in place during COVID-19 on highly vulnerable groups. So I think of when we talked earlier in the panel about those populations in which are already at very high risk. We know that mothers of infants born quite preterm or critically ill already report about 35% higher rates of depression, anxiety, stress. And so we think about it, I mean, if we just pause for a moment, no parent wants to be without their newborn or their partner to help cope even after a normal delivery. And if you think about having a baby who's extremely preterm, critically ill, and throw in the fact that during the pandemic, most parents, about 70% of NICUs, neonatal intensive care units across the country, restricted families from being present. And if they did allow a parent to come, they restricted the partner from being there. So what we've done is we've taken an already highly vulnerable group, we've removed from them their supports, their network, their social support systems, and we've left them to cope with having very high stress levels of coping with a sick baby. When we talked about, and I'll talk a little bit about some of those scenarios, but just to also put it into place, in the worst time, some of these units would restrict any parent from being present or at least restrict to one. So then, as I said, that meant that mothers were often by themselves without their partners. We also, given the fact that there was limited childcare or in inability for many families, they had to choose. So this put mothers also at extreme stress to say, for example, choose to be home with a child who needs to be homeschooled or without daycare, or choose to be with their child in the neonatal intensive care unit. When we interviewed mothers, they used words like feeling broken, that they, from just making those choices, that how they would ever recover, even in those who didn't have pre-existing mental health issues. From our interviews as well and our national survey, we identified both issues with both physical well-being as well as mental health. So for example, many mothers, perhaps after cesarean section, couldn't leave the hospital. They were from a different province or no social supports to come. Perhaps they couldn't fill their medications. We had families who couldn't have clean clothes, families, mothers who could not leave the hospital if they were staying with their infant. And so we also had families when we asked them about, sort of additional stress above and beyond just having a sick baby, just living through a pandemic. What did these restrictions to their access to their baby actually mean to them and stress? And over 75% of mothers said that it actually was like extremely stressful or worst possible stress above and beyond just living through a pandemic. So going forward, we're really concerned not only for the immediate time, but also how this sets the stage for their subsequent mental health and well-being, their interactions with their infants. And if we think about even the differences with fathers, there have been some babies who may spend 3 months in the NICU and the father was never able to even be near them. So the mom also had a tremendously stressful experience with no one to share it with, and then to go home to a family. They don't know the baby. They haven't had the experience. And then maybe perhaps in many cases, these infants continue to have health issues. So it really sets these families up for considerable ongoing mental health and concerns. And we're, continuing to research this, but these are just some of the unintended consequences that I don't think people often realize with some of the policies that get put in place. And having families of vulnerable children like this engulfed in the same as an adult centers, where, for example, in our center, we had no COVID cases whatsoever. I think we just have to really think about what do some of those decisions mean in the long term for these highly vulnerable groups.
I mean, I just can't imagine having a baby in the ICU and being, having to stay home while they're alone in the ICU. I mean, that is just, an unintended consequences. I mean, that just sounds like a nightmare for a parent. I know you mentioned before that there was a lot of inconsistency too, that some hospitals had different rules. What were the hospitals? Were there places that did well, like who would be kind of like models for how maybe it should have been handled, or what do you think would have been a better approach to take in this situation?
Yeah, so I mean, I think looking back, no one was surprised that, this is unprecedented times. Back in, March of 2020, when the pandemic first hit, that everybody closed the doors. It was public health across the board. And what we found was, when we then did a subsequent survey, what we realized is that there's continues to be severe changes or variation across the country. So many places began to look at these unintended consequences, began to look at the research that we know about the importance of parent present, both for infant health outcomes and parent well-being. And they did open their doors, or they said it different. The pediatric centers would be handled differently with at least 2 support people. But this did not happen across the country. And in a recent national survey, we know that even in the same city, so even looking at, some people might say, well, epidemiology was considerably different across the country, but even in the same city, one family might be able to have access to their baby 24/7, with their partner being able to come and go, them being able to go home with their children at home and come back, whereas across the street, they may be able to sign up for 1 hour to be present a day by one person, or have other family members never be able to be there. And so there's been no change over time. So I think when you just talk about what's the difference, The decisions that first happened were in isolation. Again, public health, we understand, unprecedented time. But what the centers who did well was because they then brought stakeholders. They brought families to the table, they brought researchers to the table, and they listened to what some of these unintended consequences, and then they made changes in their policies accordingly. In the centers that haven't made it changes, they're still not having the stakeholders at the table. And so I think they're being encompassed in sort of a broader what's good for one is good for all. And we know that that actually is not the case.
Well, I want to talk a bit more about solutions, and you just raised a really good one, which is who's at the table when we're actually creating policies and building a mental health care system in general as well. But you also highlighted something that we talked about a lot during the pandemic, which was this feeling of isolation. And I'll put this question to Joanna, because I know in your research, you guys found that that women reported more subjective isolation with men. And that kind of jumped out at me, because I wondered if women wouldn't have been better at, having, more friendships, that they might have been better at maintaining those friendships during Zoom than maybe their husbands or the men in their lives, not to stereotype, but that was one interesting question I had, why that was. And you also found that in terms of like problem drinking during the pandemic, that was also higher among women. And those were two differences that really stood out to me. I wondered if we know what was happening there, what's behind those findings.
Yeah, very, very interesting work by people other than me. But I think the reason for this finding is that social isolation is very subjective. Like, we can both spend 10 hours a week chatting with friends, and you might feel like that's all you want. Like, you're perfectly happy, and I spend 10 hours and I want 20 more. I feel isolated without more of that. And there is some evidence that even before the pandemic in general, that women tend to rely more on social networks for coping with life in general, and that there's also even evidence that social isolation, while bad for both men and women, while linked to mortality risk even, it's a stronger link with mortality risk for women. So it seems like social isolation is really perceived or experienced as a lot worse by women than by men. So it seems like it's a worse stressor among women than among men. And for example, a study by Rachel Heron from Brandon University, who interviewed older women and men, mostly women, living in rural Manitoba, she found that people identified this loss of autonomy of being able to go out to social spaces, like going out to church or having coffee with someone else, like that was really driving their sense of loneliness. So they felt that being on the phone or they didn't use Zoom because they were elderly people, weren't quite that digitally literate, that this loss of the social spaces really was the driving factor for their sense of isolation. And then I would personally say, of course, there's Zoom and telephone and all kinds of other ways to connect, but it is a fundamentally different way of connecting with people. And you might not, in some online interaction, like connecting with people on Facebook, also comes with other risks, such as perhaps feeling envy or feeling inadequate when you're seeing other people's lives. So that it is a fundamentally different way of connecting with others. So this is speculation, but there's some ways in which perhaps moving all social connection to online or on the phone or some other medium, that might have actually made it worse for some people, because they feel they couldn't share their emotions the same way that they can over a cup of coffee in their favorite cafe, So it is not a total replacement, and perhaps for some people more than others, but there is a lot of other cues that come with social interaction that are hard to convey over the phone. And you also mentioned, since you asked me to also speak about the coping and substance use, several studies showed by Lindsay Rodriguez, for example, from University of South Florida, or Jeffrey Wardell at York University, they showed that women tended to use more coping strategies, both positive and negative coping strategies, actually, than men, And drinking seemed to be one of those ways that especially younger women under 40 were using more in response to COVID pandemic stress. And one of who knows why, but it might have been, it's also been linked to just more extreme experiences of stress. So it could have been a secular thing. It could have been a vicious cycle of feeling more distressed, drinking more, feeling more distressed, and so on. So it could be that one of the reasons for greater coping through drinking has been because they've just felt more anxiety and more worry and distress.
So I think, I mean, you're highlighting, especially in the beginning of your answer, how the role that isolation played. And we'd already been kind of having that conversation before the pandemic on loneliness being a significant predictor of poor mental health, and that somehow we need to address that almost from a social policy standpoint. So I'm interested in putting that larger question to the group. We learned the importance of social support, I think, in a very, from a mental health perspective, not just as a let's hang out with our friends, but also how important it is to our physical and mental health. But even that conversation around mental health, as I said off the top, it feels so different now. It's like, I mean, I remember covering this 15 years ago. We did a big project. It was almost like a story saying, hey, mental health exists, mental illness exists. You know, there's a stigma around mental illness. And it was very much this just working on awareness for so many years. And then we kind of shifted to improving the system and then also trying to get governments to pay attention. And now we're just at this place where the conversation feels different. And I wondered for you guys, what different conversations as people who work in that field, do you feel that, do you see that shift? Is it easier to talk about? Are people just more aware? Do you feel we've kind of past that tipping point? I don't know if who wants to jump in. Anybody? Lara, I see you nodding. Do you want to go first? Yeah.
Sure. I was trying, it was a warm welcome to anybody else, but I'm happy to jump in. My personal experience is that I think mental health is now receiving more attention than it has, at least over the last decade or so, as I've seen in my career. I think while working on this paper with the Mental Health Task Force, we had a lot of loud voices who have been very concerned with mental health and mental health support and strategy for decades, pushing for what has been called this parity of esteem, where we live in a world where someone with physical challenges can find access to support and care in a way that we cannot for mental health challenges. And there's this big push for this parity of esteem, that someone should have access to equivalently effective treatment at the same rate and ability, but we don't live in that world yet. And so while I think there is now greater attention being given to this topic, I think we're still very far from that perfect utopia of this parity of esteem. I mean, hopefully we can minimize concerns in the first place, but until we're there, we need better access. Our group tried to think about how to improve that, and I'm happy to speak to that later if you like. But I do think my hope is that this extra attention being afforded to the topic now will translate not just into good intentions, but to some policy changes that will really shape the lives of people for the better.
Carla, can I ask you, working with youth, because I know if I think about my own teenagers, the way they talk about mental health is so different than I remember being certainly talked about when I was a teenager. And so they just seem so much more literate. What did you see? What's your sense of what happened during the pandemic? Do you think that there's been a shift in youth as a generation themselves, our current Gen Zs, I guess, and young millennials, and also in the way that the adults around them view mental health? Have you seen a change there?
Absolutely, Erin. And I mentioned in some of the projects we did this past year, speaking with youth in various communities. One of the recurring things that they talked about was how there is a greater awareness now and acceptance of mental health, in terms of this also being reflected in adults. I mean, like like you said, and like Lara said, I've been doing research around mental health for about a decade now, and it's definitely a different conversation. And even in earlier research, that in my earlier research, some of the youth I talked to actually said, well, it's actually the adults that need more mental health awareness and more mental health literacy. From the projects that I've been involved with, these are one of them is partnered with community organizations. So these are adults who are working to better support youth in their community. So there's definitely, I would say, much more awareness, but also acceptance of mental health and poor mental health during the pandemic, which I thought was quite different, and the youth, the young women I spoke with, definitely highlighted in terms of an increase in awareness campaigns. So they were seeing more sharing of stories and more acceptance of struggles on social media like TikTok. They were more aware of their own mental health and also the mental health of others. And for them, that was a realization to also check in and to learn strategies for checking in. And this tied into some of our work around peer support and how that could complement other mental health supports alongside, but not in place of services that should also be made essential. One of the things that we also heard is that there was a concern that only those who could afford access to mental health care, like counseling, for example, will be taken care of, and that that these supports beyond crisis intervention should really be seen as should be essential.
Well, I want to shift now to talking about solutions in the time that we have left, because I think that's a really important conversation. But let me put the first question to you, Carla, because you raised a really, what I think is probably one of the most significant challenges we have right now when the governments talk about the millions of dollars that they want to invest, and that is who is going to deliver these services. We know we have a shortage of psychiatrists. Psychologists have booked up rosters, and they're not, most of them aren't under the public system to start with. Bringing them in is going to be a challenge. Social workers, there's not a lot of support in schools. You mentioned peer support, which I think is a really interesting, because that's sort of just been sort of an add-on, right? Oh, hey, we have peer support, but are you suggesting that that's an area where we could expand help fairly, maybe more easily, and that we should make that more a formal part of our system than it has been? What would that look like?
That's a great question, Erin. And I'm actually part of two projects that are currently looking at peer support for reducing readmission rates, for example, with known patients to health systems who are readmitted for mental health reasons. And so one of the models that that project is looking at is really in direct collaboration with the health authorities, with the healthcare providers. So it's quite an integrated and coordinated system, and it's seen as filling a particular gap while continuing to advocate for psychiatrists, for other healthcare providers, counseling supports to be in place, and so I would say that peer support is definitely a promising area, not a panacea, and could provide unique support because of that lived experience. But we still have quite a bit to learn around peer support. And most of my work has been with youth. And so when they talk about peer support, they talk about it as part of integrated services, like as part of a hub, where that's a component that provides a unique service and fills a unique need, while also ensuring that those broader supports are there. In some other work and interviews with healthcare providers as well, and service providers in community. And the other consideration, and this goes back to what I said earlier about social determinants of health, is that there continues to be a need to look at those fundamental kind of determinants of health, of mental health. As one service provider said to us in an interview, we could give counseling to this young person, but without addressing, not having stable housing, without other kind of more, without addressing those other social determinants of mental health, then the counseling will only be able to address particular aspects of that mental health challenge.
Well, I guess let's pick up on that, because I think, certainly I've heard that too from psychiatrists working in the emergency room, and someone comes in and their real issue is that they don't have stable housing, or they've lost their job, or they can't afford to feed their families. And so managing their mental health issue in that moment is not going to treat what's really behind the problem. How do we address that in our current system? How would we improve our approach to seeing people more as like whole people and not just a patient coming in with like a particular problem? I'll put that out to the group. If you want to raise your hand, you can jump in. But to me, I wonder if, when I talk to patients, they say there's a lot of focus on like the diagnosis and the treatment, and not so much maybe about hearing that person's story, which I think is partly, Carla, what you're getting to. There's other things going on in that person's life that maybe are even more important in that moment than the label of depression or anxiety. Joanna, do you want to give that? Sorry,
I don't have a solution here. I just wanted to say that you make a really good point. And one other thing that came out in our review is that some of the factors that are creating the problem, or that are factors in the greater depression, such as limited childcare, and greater time demands, those are the very same things that prevent access to mental health care. Because what are you going to do with your young child if you need to go travel, see a therapist, So I do think there has to be done more to think about access to mental health care, and think creatively beyond the traditional model of seeing people in person, and maybe think creatively beyond someone with advanced degrees, who are notoriously in short supply, and perhaps going to people like peer counselors or some other people who can provide similar help. So I do think you're making excellent points, and I have no solution, but maybe someone else has ideas.
I don't know, Erin, maybe I'll just jump in with one of the things that we've done. So over the past several years in the neonatal intensive care unit, we have been utilizing what we call parent partners. So people who've had lived experience, who want to come back, and who really help families navigate many of the stresses, both in hospital as well as their transitions to home. And one of the things we were able to do through the COVID-19 is really to also embrace through one of the national parent groups. And so through their social medias, through their various nonprofit organizations, we were able to actually mount sort of a greater peer partner group that was already pre-existing through their networks. And this was able to then be for families who not only in each area, but who locally, who nationally could reach out into this sort of a trained parent group that would help either with bereavement, help with just sort of living in the neonatal intensive care unit, so they didn't feel like they were coping alone. And, I think that one of those things that sometimes we don't always think about as clinicians or researchers, first we go to government and sort of existing institutions, of course, academic or healthcare, but we really do need to think about large parent organizations, that have much of the infrastructure, but also the ear and of many different stakeholders to be able to help leverage and try to meet the needs of families. And we are quite successful with this. And one of our most recent grants that we're going to build national consensus recommendations on how we move forward in a post-COVID solutions is really co-led at that tri-council level with the executive director of the Canadian Premature Baby Foundation. And so, again, I think it was one of the reasons we were successful, but more so that we were actually able to reach the people that we were trying to help most.
I find that really fascinating what you guys are talking about, because it's basically essentially social support. Like, I know you're training people in order to feel more comfortable, to have the skills to manage what are complex, bereavements, so that they feel more comfortable having those conversations. But when I read the studies like yours that come across, social support always seems to come up as being like this important factor for people, and yet we haven't really formalized it. And when you talk about those groups that are often in the position of advocating, but maybe to have this wealth of volunteers and people who you could actually use. So that sounds like an amazing program. Laura?
I just wanted to add, I love these ideas and building out capacity from trained clinicians and mental health care workers. I also just wanted to put in a strong vote for taking more preventative measures. I think responding retroactively, we're already behind the 8 ball. I think there are lots of ways in which we can build these capacities. We can build social support. We can build more integrated healthcare systems before there's a crash and a reliance on it. By the time people are showing up with severe distress and anxiety and depression, might be, we've already failed, if you will, as a society to kind of build into supports for that. And so I think a lot of this money should be thought about how to build stronger communities, how to integrate the services that are available into what's already there, and to capitalize upon these networks that exist and maybe make more formal integrated support networks rather than waiting on people to call out for help, kind of building this aid into what we've already got.
What can I just follow up on that? Like, what
Sure.
What would that look like? What if you had, some money, some millions to spend? What kind of system would you design that address that?
Yeah, I have a few thoughts. I see Joanna has her hand up too, so I don't want to keep her off for long.
Oh, no, just one thought, and then you can mention yours. Like, we know, for example, that unemployment is a huge stressor, right? And that unemployment or insecure, fragile employment really contributed to mental distress during COVID. And one of those ways in which you can tie it on is, for example, with unemployment services, right? Or employment services in general. So if that is bundled with mental health support, that would maybe get at people before they're in a really dire situation. And it would normalize the kind of support that's saying it's normal to feel these ways. And maybe here are some places you can get help. Lara.
I was just going to propose some creative solutions within various educational frameworks. I think in schools, we can be teaching more peer support. I think there can be in college and university, post-secondary education. I think there could be more peer mentor supports. I think it doesn't even need to be primarily for the mental health outputs, although that is an obviously desirable outcome, but just to build stronger social peer networks in times where people are going through major life transitions. And I think that would extend to many other life transitions as well. Marcia, I'd be curious to hear your thought as new parents. Carla, you mentioned you were on family leave during 1 year of the pandemic too. You can imagine having that infrastructure as support, that kind of web of support. It doesn't, the mental health outcomes are obviously a really wonderful, important outcome of that. But I think just providing opportunities, I guess, sorry, you pushed me for more concrete suggestions. I guess what I'm suggesting is more peer, probably one generalizable suggestion would be to think about ways to connect communities more, whether that be through shared interests or life experiences, whether it become, a parent, whether it be parents who are now sending their kids off to kindergarten and facilitating some kind of cohort there, or whether it be new incoming first-year students, kind of finding ways to connect these people so that they have friends and supports through day-to-day, but also people to rely on in difficult times. I'll stop there because I saw Marcia unmute.
Yeah, I was just going to say, yes, our focus is primarily on already that high-risk group, but just thinking back, what we also found with the COVID-19 was typical just for healthy newborns and moms, the postnatal care, almost all in-person clinic stopped. Clinics, breastfeeding clinics, drop-in centers, everything was stopped. So we developed Essential Coaching for Every Mom. That was just a mobile text, sort of got messages every day to give you the information that sort of every mom, sort of based on what we anticipate should be coming around the development of the infant for the first 6 weeks. Sort of typical things to reassure mothers, where to go if they needed help, sort of asking around, sort of help, giving them sort of focusing more on that resiliency. So information, but also things on, try this. These things help people, if you find you're feeling a little overwhelmed with this, maybe try this, reach out here, and really sort of thought out of the box of how they typically would have received care and how they could find those elements in different ways. So, and we actually had amazing uptake. We did a feasibility test just to see if we could do everything virtual to find mothers, to engage them, to have them finish. And we did find that this did reduce their stress scores and their depression scores when compared to those moms who were randomly assigned not to get the messages. So, I think those are some of the solutions that I know lots of people have been using mHealth and eHealth, but I think people were probably, it just helped push some things along that maybe weren't always available.
I've just really found this whole conversation so fascinating, and I see some really clear themes. Like when you're talking about aftercare and preventative care, you're basically talking about these social contacts and the way to do it in a different way than just like you have to have an appointment with your psychiatrist or your psychologist or your doctor, but galvanizing the community. And Joanna, you kind of raised it at the beginning because one of the negative effects for women was this higher rate of subjective feeling more isolated. So do we think that in fact more social support might actually improve those mental health stats for women and even prevent them from occurring in the first place? Do you think that could have even a bigger impact on women?
For sure. Yeah, no, absolutely. That is speculation, but I think you're absolutely right. It should, for those people who suffer the most from this kind of sense of isolation, providing more social contacts, having people reach out to them without them having to go somewhere first, I think that would be absolutely helpful.
Well, I see we only have 2 minutes left on our chat. I want to put it out to the four of you. Are there any final thoughts that you wanted to add? Any quick solutions? Any things that you would really want people watching, or any policymakers listening to really think about going forward as we hopefully emerge from the pandemic?
Thanks, Erin, and it's been so wonderful to hear from my colleagues today. I mentioned earlier I was a brand new mom of a 3-month-old when the pandemic started, so very much lived the experience of reduced postnatal care and trying to figure out how to be a new mom in the midst of it all. And one point that I just want to add to what Joanna had mentioned is to look at multiple and increased ways that women can access care. And what we saw with the pandemic is virtual care was something that was emergent. It really fast-tracked that. We're really looking at hybrid models, various flexible forms that people can access care at different entry points and meeting people where they're at. If they're young people, we know they'll access supports in schools, for example. And if there are postpartum moms who are still in care in hospitals, having supports maybe in place there too.
Erin, I'll just only make one comment that we didn't sort of cover, but we sort of implied is certainly we've really utilized e-health and virtual care and mobile technology. But one of the things that we heard very clearly from some of the families was, especially minority, new immigrants, was that wasn't necessarily what worked for them. And so I also think it's so important that we don't think of that one size fits all, and that we have so much to learn from different groups and in ways that they find social support. So for example, some of our families very much into storytelling, that virtual care just didn't do it for them, as we've alluded to earlier. So I would think going forward in really engaging the people that we're trying to care for, have them at the table, help us designing research studies, making policies, and really also trying to think about being proactive, as we said, and also trying to repair some of the things that have happened over the last 20 months.
So much to think about. I want to thank you all for coming. I really enjoyed this conversation. I'm going to keep an eye on all your research going forward, probably get some good stories out of it. So thank you very much for sharing your knowledge with us today. And thank you for everyone listening.